high-risk person in your family or in your business or your club, again, that's where you want to carefully look at the guidance or call our 258 info line to see if the way you plan to implement it is the best protected and the most feasible. But we can't answer that without your input of what works for you. So thank you for everyone who understands that and takes the initiative on their own. There are instances where large-scale quarantine or stopping events and congregation could be ordered, but again, the more the voluntary things with good guidance happen early, the less likely that we have to go into that mode. We will use evidence, and that evidence will be based on the evidence of spread in the community, and we're going to be getting better evidence of spread in the community as we know now the testing will become more available to us. A couple of specific examples that are more local that we've been working on. I am in a group with 6 other local health officers in the 7 most populated counties in the state. And in our jurisdictions, of course, the largest percentage of the population resides. We have been working on school closure issues and on sports events and other messaging for large scale. Yesterday, we unanimously took an action to write in concert with the Department of Public Health and Human Services, not in a way that takes away local adjustments, but to try to not have so much confusion and varying responses across our state, which is confusing for people. We issued a recommendation from all 7 of us through the Department of Public Health and Services to the Montana High School Athletic Association that it is in the interest of the public health and to prevent the transmission of infectious disease as well as fairness related to these sporting events that all spring 2020 sports seasons, games, and tournaments be canceled. I heard back on that. We have also worked to try to get as much on the same page initially with school closures, and we have issued actually a draft, but it's not going to change much. We have issued a similar statement from the 7 of us to the state health department that we think is consistent with CDC guidance, allows for local decision making, but we are recommending and we intend to practice that if there is a case in the school, could be staff, teacher, student in the school, we will work with that school, but likely initiate only in that school a short closure so that the health department can get in, find out who may have been exposed. It's going to be different in every school setting. Work with the school to make sure that high-risk students are identified, do anything that that school and that population needs to do. But that would be the purpose of those closures. With that, thank you. That's where things stand right now in our state.
Hello, my name is Ross Miller. I'm the chair of the Missoula City County Board of Health. I'm going to talk about our community's quarantine and isolation policy. Federal and state law requires that the Missoula City County community have a quarantine and isolation policy. Our policy is based on and supported by those federal laws. It is consistent with and in compliance with all federal and state laws and requirements and guidelines. Therefore, it's quite similar to the quarantine and isolation policies throughout the country and other communities. The quarantine and isolation policy outlines when and under what conditions quarantine or isolation is warranted. Quarantine is used for those who have been exposed to an infectious or communicable disease until such time that we know the person did not become sick and infectious to others. Quarantine can be implemented either by voluntary request or it can be ordered. Isolation is then for those who become ill with an infectious disease. It also can be implemented either by voluntary request or by order. Our quarantine and isolation policy is current and in compliance with all laws. It was updated last in February of 2019. Our quarantine and isolation policy authorizes the health officer, Ellen in our community, to use the policy and provides due process for people that may be affected. It asks first for quarantine or isolation as to be voluntary as a first step, but then it does provide for a mandatory order from the health officer should that become necessary to protect the public from the spread of an infectious or communicable disease. The Missoula City County Board of Health is comprised of 7 members appointed by the City Council and the County Commissioners. As chair of the board, I've signed the quarantine and isolation policy with the consent of the full board. There is by the end of the day today, there will be a link to the quarantine and isolation policy available on the Health Department's COVID-19 website for anybody who wants to actually read the full policy. Thanks.
My name is Cindy Fire, and I'm the incident commander for this COVID-19 outbreak. So I just want to expand a little bit on what Ross was talking about with the quarantine and isolation and how that is actually operationalized in our office. Right now we don't have any cases in Missoula County, but we know that that is probably going to change in the foreseeable future. So what we are doing in our office is when someone identifies to us that they have been a contact to a case or they've had traveled to an area where we know that there's been a lot of spread, we ask those people to self-isolate and essentially quarantine for the 14 days of the incubation period for this disease. Our nurses are checking in with them daily to check to make sure that they're not having a fever over 100.4, that they're not having any shortness of breath, and that they do not develop a cough. If they do, at that point, we ask them to go call their healthcare provider, and we assist them in getting in to get a test done, so that at that point we can figure out if this is actually what they have. Once we have cases that come back positive, we will be asking those people to isolate themselves so that they don't spread the disease to other people, and they will have to be isolated until we have 2 negative tests. Sometimes that might be as short of a time period as a couple of weeks, and it might be as long as 6 weeks. It just depends on how severe the illness of the person. So that's how we operationalize the quarantine and isolation procedures. I know that there's been a lot of questions about testing. Testing just this week has become much more available in our state and in our community. We do ask people to call their doctor and find out if they should come in to get a test. The doctors are then having to rule out other common respiratory diseases. Many of you know, and we've been saying, we are still in the middle of flu season. We're seeing a lot of flu. So we want the providers to be able to rule out the disease that we are seeing a lot of before we start running tests for this disease that we have not yet seen. As that becomes more available, we are going to start seeing more cases. The things that we want the public to know is that there are things that you can do to protect yourself. If you fall into the high-risk category, and that would be people over the age of 65 with chronic conditions, people under the age of 65 who have chronic respiratory conditions or are immune compromised, consider not attending large events. Make sure that you are doing all of the things that we always say every flu season. Wash your hands, cover your cough, don't shake hands with other people, try not to be around people who are sick. But you want to take care of your own health, especially if you do fall into those high-risk categories, to make sure that you are removing yourself and doing what we call social distancing from any situation where you could potentially be exposed. We know that a lot of businesses and workplaces are trying to help identify those people who could be at a higher risk and making accommodations so that they remove themselves from a situation where they could be exposed. If you do not fall into those high-risk categories, we still want you to do the things that you can to protect that vulnerable population. And that does include washing your hands, covering your cough, making sure that you're using hand sanitizer if you don't have soap and water available. While I know that hand sanitizer is flying off the shelves right now, it is still important that if you have it, use it. So those are the ways that we can protect other people in our community that may be at higher risk of developing severe disease from this.
John Aiken, Mayor of the City of Missoula. Again, thank you all for being here today. We appreciate it, and we appreciate your help in conveying these important messages to the community. A couple of things that you need to know from the City of Missoula's perspective. One is that we're operating under a business continuity plan today. And that plan is designed to get us from soup to nuts, depending on the duration and severity of the pandemic. But what folks need to know is that we will continue to provide the essential services that are necessary for the city of Missoula and this community to continue to operate. You are going to see first responders responding in the ways that they always have to emergencies. You will see us continuing to emphasize public safety. We will continue to maintain facilities. And we've taken some steps already to not only protect those vulnerable individuals who are employed by the city of Missoula, but we're taking additional steps. As Ellen suggested, there will be disruption. Disruption for us will largely be inconvenience. What you'll likely see at the city of Missoula, and in some cases already see today, you're not going to go to the finance window to pay your bill. We're going to ask you to mail it or conduct that transaction online or drop that payment in a box. We are likely not going to send an employee into your home to install a water meter because that is not a critical issue today for you. So if it's not emergent, we're not going to be in your home, generally speaking. But we are built and equipped, and we have planned and prepared to continue to deliver those services that folks absolutely need in our community. What goes missing until there is critical issues such as this one is the fact that our partners plan relentlessly for events just like these. It's not very sexy, it doesn't get a lot of coverage, but that planning and that preparation really comes into play today. You see the incident command structure, you see the communication tools that are available, and we're continuing to refine those based on emerging evidence and guidance that we're receiving every day. This is a very fluid situation, and I can tell you from the city of Missoula's perspective, we have all hands on deck, and we're also communicating pretty relentlessly with our partners, and new partners are coming on board all the time. We're very interested in the feedback that we're getting from the frontline healthcare providers in our community and how we can cooperate and support those healthcare providers to ensure that people who need critical care are getting it, that we're screening appropriately, that we're testing when necessary, and managing to control to the degree that we can that curve. A couple of things to note. One is if you are a private business or even at a family level, you can do some planning of your own. Our plan is specific to us as Missoula County's is to that institution, but all of us can do that planning and take precautions. And finally, I think what you heard from Cindy and what you're going to hear relentlessly here is that that personal inconvenience, that slight change in your lifestyle could make a huge difference in the community. So there are going to be lots of opportunities to make choices around how you engage in the community. And this is a time to look at those choices. And sometimes the choice is to stay home. Sometimes the choice is to cancel an event. There are a lot of ways that we as individuals and organizations throughout our community who do good work every day can improve that work in a time of necessity. I trust that we're going to get through this just fine, but it won't be without bumps, it won't be without consequence. But we are prepared, and I'm confident that working together as Missoulians always do, we can ride this out in a way that we can be proud of when the dust settles.
Thanks. I'm Josh Slodnick. I am a Missoula County Commissioner. I'm currently the chair of the Missoula County Commission, but sometimes, like today, I feel a bit more like an ottoman chair. But how can I make a joke at a time like this? And I'm intentionally making a joke to pass on that we will get through this. Life will go on, and it's all right to laugh and make a joke and be ourselves, even in a time of moderate crisis. Like the other elected and government officials and educators, etc. at this table, we provide services, and we are going to continue to provide those services. And we have a responsibility to those receiving those services, and we also have a responsibility to those that we employ, the 850 folks who work for Missoula County, who do the work of providing those services. So we are asking our other Missoula County electeds and department heads to begin to work on changing plans on how we do that service delivery and how we protect the most vulnerable of our employees, those who are older or fit the categories that we all know about, or who have those same folks within their home. As the mayor said, everybody can do something like this within all of your workplaces. And each plan will be a little bit different, specific to the folks who are involved. And we can do this. There's a bit of an irony here, just jumped into my head. Working together, we can remain apart. That's what we'll do.
Thanks, Josh. Really good to sit next to you. Chair Ottoman. My name is Brian Von Nossberg. I'm the president of the Missoula City Council. Some of my colleagues are here as well. I appreciate that. Our second grade daughter, Austin, regularly reminds me to breathe and practice mindfulness. That's good advice from a young, wise soul, and I think it's a good place to start. She also told me in no uncertain terms how upset she would be if I did not relay specific hand washing instructions complete with song options and proper duration. I'm not going to use this opportunity to do that, but Superintendent Watson, I want to confirm, I can confirm that your staff is doing excellent work on that front. My wife and I are constructively critiqued on a daily basis, or hourly basis. I also want to thank constituents who have reached out with offers of help, information, suggestions, etc. Missoula is a passionate, engaged, resourceful community, and we're better for that, and we're going to emerge, as others have said, from this experience, better for that as well. My colleagues and I are listening, and we hear you. Ellen and others have spoken about disruption, and I want to come back to that. I think it's important to acknowledge that this can be a dislocating and a dizzying experience when events move so rapidly, when the routines of daily life are upended and turned upside down. And it's certainly been that way for me and my family, and we're going to see more of that in the days and the weeks ahead. So understand you're not alone in feeling those things and feeling that way. But I think it's important to highlight two things from that disruptive and dizzying experience. The first is that the responsible actions that organizations are taking to promote social distancing, which is a term we're all hearing a lot and we're going to hear a lot more of, those are a cause for optimism. And that may seem a bit odd, but I would argue that they are a definite cause for optimism. Organizations, big and small, here in Missoula, statewide and nationally, through their leaders and their staffs, are taking this seriously and doing what they can to limit interactions that facilitate the spread of the virus. And those are all responsible things to do. The university has taken those actions, the city and the county have taken those actions, as Josh and the mayor have described, and I'm seeing organizations and information from organizations all over town. I just saw something from the Roxy Theater, really proud of the actions they're taking on their front. So that brings me to the second thing I would emphasize. This is an opportunity for empowerment and resolve and action. Day in, day out, Missoulians rise to challenges, big and small. Sometimes those are daily challenges, sometimes they're challenges that span years. We support an incredible number of organizations across the community, the Poverello Center, the YMCA, the YWCA, the Food Bank, et cetera, et cetera. This community gives generously to those organizations. Continue to do that. Reach out to your neighbors, practicing good social distancing, and help those folks, not just the neighbors that live next to you, but all of the folks around you. We have a great tradition in the city and in the state of doing that, and this is an opportunity to continue to do that. I'll simply conclude by saying I love this city. We all do. It's a community, as I said, filled with passionate people. It's a community that values science and a community that knows how to come together to help each other. By working together, we can protect our loved ones and our neighbors. It's time for all of us to sacrifice a little to help everyone a lot. Thanks. details. I haven't met. I'm Rob Watson, the Superintendent of Schools for Missoula County Public Schools. I have just a few things to discuss. I wanted to discuss briefly on what we've already done to prepare, and also some restrictions that we're going to put in place after spring break. To be clear, we are on spring break this next week, so we won't have any schools open next week. Briefly, what we've already done, and I think our staff has really stepped up and taken our advice and worked through some of this stuff. So, as was mentioned, we've increased our protocols around hand washing, as well as wiping down frequently touched surfaces. We know that those things both help stem the spread. We've also asked our teachers to begin to prepare for school closures should we get to that point. One of the ways they're doing that is using learning management systems for remote or online learning and setting those up. We've also discussed at the district level how we might prepare for school closures should that come to be with regards to delivery of really critical services like our school lunch program. And other services that will need to be delivered in the event of closure. So we have taken some steps and preparations and planning for that. The other thing I wanted the community to know is that we don't operate in a vacuum. We've had several opportunities to increase our communication, not only with our local partners here at the table, but also with our state partners. I was on a call this morning with the Office of Public Instruction, who's giving guidance for all schools in the state of Montana. I know that we have members that represent schools that are sitting on the governor's task force around this issue. I spent most of the day yesterday in calls with the AA superintendents around the state talking about protocols that they're doing in their communities. So I just want to make sure folks understand that these decisions are not made in a vacuum. I want to talk briefly about school closure. Please understand that safety, student safety, and safety of our staff is our top priority for us in the school district. We also are part of the community. We recognize that we play an important part in the community, and actions that we take will impact our community. We have not received any specific guidance, orders, or instructions to close schools after spring break. In fact, to the contrary, what we received this morning from the guidance from the Centers for Disease Control was really about, am I getting feedback on this? What we received this morning from the Centers of Disease Control was really guidance on when to consider district-wide closing. We're not at that stage yet. However, we know we could be there very quickly the way that this is evolving. That's why we're preparing for it. We'll take direction from the local county health department as well as from the governor's office should we need to move to district-wide closing. Having said that, though, we are prepared to do short-term closing as was described by Ellen. So should there be a case of student or staff that's confirmed, we will move to a short-term closure at that school for two reasons, and again, this just involves that school. The first reason is for cleaning of surfaces and cleaning of school, but perhaps secondary and more importantly, that short-term closure, 2 to 5 days, which is being recommended by the CDC, would allow for the local health department to identify close contacts and to stop the spread among students if they were to come back to school. So we do support that, and we will move to that fairly quickly if needed. But again, that's only after there's a confirmed case of either a student or staff member at that school. The last thing that I wanted to mention, and I'm going to read these because they're fairly specific, but we are taking steps, sort of self-restriction steps after spring break. So all of these will take effect starting March 23rd. We have already prepped for this in a few instances, but we will cancel, postpone, or suspend all out-of-state school-sponsored travel for both staff and students. We will do this for March and April, and then we'll reassess for May and June. So that covers out-of-state travel for staff or students.
We will also suspend, cancel, or postpone any school-sponsored activities that involve community members in attendance. We believe that there is a potential for spread, obviously, among community members. We want to be sensitive to that. We know that there's community members that have compromised immune systems for a variety of different reasons. We want to take our part in making sure that we're not part of that spread. So for that reason, we're going to suspend, cancel, or postpone any school-sponsored activities that involve community members in our schools. Again, this will happen for March and April, and we'll reassess for May and June. This means concerts, plays, other activities that bring community members together. It may also include any activities that are sanctioned by the Montana High School Association. That decision is a little bit outside of our control. That would need to be made by the Montana High School Association. And finally, we will suspend, cancel, and postpone activities during the school day that bring large groups of students together unless absolutely necessary for the function of the school. And that's really important that the community hears that, because we have activities during the school day, like school lunch, that bring students together, large groups of students together, that is necessary for the function of the school. So there will still be some activities during the day. School lunch, we have a ACT test coming up for all juniors. Those activities we will need to bring students together. But any activities that are not essential to the function of the school, for example, school assemblies, we will cancel, postpone, or suspend those activities for March and April. The last thing I would say is we sent this message to our staff this morning. None of these decisions are taken lightly. Many of our students have worked very hard to prepare for some of these activities, as you can imagine. We needed to take our time on this decision. We think this is the right decision. We hope that we can postpone some of those activities for a future date. Thank you.
Good morning, everybody. My name is Seth Bodden. I'm the president at the University of Montana. And, I start following Rob just by emphasizing that, the considerations for a university are actually quite different from that for a K-12 system. And we've been working very closely with Rob and his team, as well as our community partners over the course of the past weeks, and are tightly involved and supportive of the process that's being followed as we address these challenges and take the appropriate actions. I will also, as Brian echoed, I will confirm, having 3 kids in the public schools, that the hand washing techniques are being very thoroughly taught. I've had some good coaching as well from my 3, so thank you to Rob and his team on that. I want to acknowledge that this global situation has caused anxiety, stress, uncertainty, of course, in our schools, our workplaces, in our homes. And I want to start my comments by expressing my deep gratitude for the tremendous work of our colleagues here in the community, and of course on the University of Montana campus, from our facilities staff who are working tirelessly to keep our campus spaces clean, to our frontline staff fielding questions, and staff are working hard to ensure that learning can continue for our students. Over the past several weeks, leaders from across UM have been meeting regularly to prepare for this situation. We've been developing plans, revising those plans necessary as new information becomes available. We've had great involvement from our shared governance groups, our faculty, our staff, our students who've provided input, support, expertise, advice, and most importantly, a collaborative spirit of shared problem solving. This has been very important for us through this process, and will be very important as we continue. As others have echoed, our first priority is the health and safety of our campus community, as well as the larger Missoula community, and all of our decisions are made through that lens. As Ellen shared, completely preventing COVID-19 in our community may not be possible, but we have the ability, by taking proactive steps, to lessen its spread and its impact. And we are taking those proactive steps, primarily with the goal of reducing to the greatest extent possible unnecessary aggregation of people in groups. As many of you saw yesterday, we made the decision to move to remote course delivery starting
Thank you for joining us for this special report. Dennis and Connor are both on scene, and we'll continue to bring you updates in our noon show, our 5:30 show, and online.